So before approaching the patient, I must first perform hand hygiene according to WHO standards. Hi, good afternoon.
Good afternoon.
Hi, my name is Aya. I'm one of the nurses looking after you this afternoon. I came around the bedside just to ask consent for a procedure. But before doing so, I would like to check your name and date of birth, please.
Yes, my name's Mira Abaloni.
1194.
Right, I can confirm that the name and date of birth is correct and your MRN number is 0048231. Right, I can confirm that I'm with the correct patient. So, Mira, as I was saying earlier, one of your doctors have mentioned for us to put an NG tube for your supplemental nutrition. Are you happy for us to do that at the bedside?
Yes.
Right, so do you have any questions regarding what entails the NG insertion, or are you happy? Do you know about this, as the doctor mentioned that to you already?
He's mentioned a little bit, but does it hurt?
It doesn't hurt, it's just uncomfortable. So basically, I will insert a small nasogastric tube through your nostril down to your stomach where it will rest. So that we can put the food through that so you don't have to physically eat.
Okay.
Right? Okay, so if you're happy with that, I'm just gonna give you your call bell and I'm gonna come back so that I can gather my equipment, okay?
Okay.
Right, okay, here you go. Here's your call bell. Please don't hesitate to give us a buzz if you need anything. I'll see you in a bit. So before assembling the equipments required at the bedside, I must first clean my hands with hand gel using the WHO guidelines. And allow it to dry. So now that my hands are dry, I'm gonna make use of the equipment here. So, Miss Examiner, is my tray clean? Is my tray disposable or reusable?
Disposable.
So it's disposable and it's visibly clean. I'm happy to use it. I've got my receiver, which the patient will use. My nasogastric feeding tube. The dressing is clean, dry, intact. There are no punctures and it's within date, expires 2023. Happy to use that. I've got my galley pot to put my warm water in. Tape to secure the tube. My 60 ml enteral syringe, which the dressing pack is clean, dry, intact, and expires 2023. Happy to use that. I've got my pH strips. Right, pH strips expires 2023. It's intact. It's not exposed to air. I'm happy to use that. Right, so I've got all of my equipment. Before approaching the bedside, I will put my PPE and start the procedure. So now that my equipment are complete, I'm happy to put on my PPE, so my apron and my gloves, before approaching the patient at the bedside. aspiration. So, hello, good afternoon.
Good afternoon.
So before I proceed with anything, can you just confirm your name and date of birth with me as I check my document?
Of course.
Right, so I'm gonna hold your span, yeah. Okay, so can you let me know your name and date of birth, please?
Yes, Mira Abalone, 1/1/1994.
Perfect, and I can see your MRN number is 00482331. I can confirm that I'm with the correct patient. I'm happy to proceed with the procedure if you are. Okay?
Okay, thank you.
So, Mira, before we begin and do anything, I would just like to ask 3 things if that's okay. Number 1, would you like me to assist you to sit up? It's just because the procedure will be more comfortable for you if you are sat upright.
Yes, of course.
Okay? I'm just gonna move this aside and help sit you up. Alright, I'll fix your pillow as well. There you go. How does that feel?
So much better, and thank you very much.
Perfect. Alright, so Mira, now that we have set you up, my second thing that I'm gonna ask you is we should establish a hand signal. So if you, for example, feel uncomfortable or if you feel that there's pain during the procedure, I would like you to ask to raise your hand like this. That will signal me to stop. And then we won't proceed with the insertion anymore. Okay?
Okay.
Perfect. The last one is, I would like to check the patency of your nostril. So, if you may, kindly cover one of your nostrils and sniff with the other.
Okay.
Right, okay. How about the other one? Perfect. Right, so we've established that your nostrils are patent. Which nostril would you prefer for me to put the tube in?
Right side, please.
Right, the right side. All right, perfect. I'll do that. Right, Mira, so we've established that we're gonna do the insertion through your right nostril. Before I do so, I'm just gonna need to measure the length of the NG tube that I will need, okay?
Okay.
Right, so there, here, and down through your sternum. So that's about 50. So just to make sure that we will get to your stomach, I'm gonna add about 5 to 10 centimeters. So should we say 55? Does that sound okay?
That's okay.
Perfect. Right? So, we've got that prepared. I'm just gonna give you your receiver. Just because sometimes when we do the procedure, you might feel the need to vomit. And that's why I need to make sure that you've got a working oxygen machine and a suction at the bedside on standby, just in case, alright?
Okay, thank you.
Right, Mira, are you ready?
I am.
Right, okay, so before I insert this through your right nostril, I'm just gonna dip it in warm water to lubricate the tube, and I will ensure that I lubricate about 15 to 20 centimeters of it, alright?
Okay.
Right, so that's 20. Okay, I'm gonna start inserting. Right, take a deep breath for me and swallow. Right, Mira, and swallow, right? You're doing well. I can sense there's no obstruction. It's going down smoothly. Can you open your mouth for me a little bit just so I can see if it's curling behind the throat? Perfect. It's not, so I'm going to proceed. Right, carry on. Okay, now swallow. That's it. You're doing well. Another one. Good job. Right? We're almost there. There we go. Swallow. Thank you. One more. Okay. Swallow again, Mira. This is the last one. Right, okay, perfect, and hold still. I'm going to secure this for you, okay? Well done, my dear. Is in place and we've established that at the 55 centimeter mark. I'm going to secure it with my pre-prepared tape so that it doesn't move about and it doesn't fall out, and that we can obtain an aspirate. Right? Well done. There we go. How does that feel?
Okay.
Perfect. There we go. I'm gonna get an aspirate, okay, Mira? This shouldn't hurt. I'm just basically going to collect some of your stomach contents and test it with a pH strip to ensure that we are exactly in your stomach. So we would want results to be from 3.5 to 5.5, okay?
Okay.
Okay, I've got all the aspirate that I need. Thank you. Right, and I'm gonna use your receiver to get my strip in here. I'll show you. Right, so my pH strip container is sealed and it's intact. It's within date and it's not exposed to air. So I'm gonna get one strip and test the pH. Okay, wait for a few seconds. Right, so following my aspirate and testing it with the pH strip, after 40 seconds, I'm going to put these results against the pH strip bottle and see what the results are. So I can confirm that the results are 5.0 exactly. So which means we are in your stomach. Okay?
Okay, thank you.
Perfect. Right, Mira? So before leaving the room and after the procedure, I'm just gonna make sure that your NG tube is secured in place. So I'm gonna put some additional tape here to firmly keep it in, okay?
Okay.
Perfect. There you go, well done. How are you feeling after the procedure?
Not bad actually.
Good, so you're comfortable.
I am comfortable.
Perfect. So also I'd like you to know, Mira, that even though we've checked the patency of the NG tube and we've checked the pH, confirming that it is in the stomach, we need further additional checks as well before they can commence your feed. So it could be they might be able to do radiological checks such as an x-ray to confirm if it's in place, okay?
Okay.
Right, so just clarifying, they won't be able to start your feed without confirming that it's in place, so you don't feel afraid or you don't feel worried about it, okay?
Okay, thank you very much.
Right, okay. Right, so do you have any other concerns before I discard my equipment and leave the room?
No, not at the moment.
Right, okay, so I'm just gonna gather these so I can discard them. You have done very well. So I'm gonna give you your call bell. Here you go. Please don't hesitate to give us a buzz if you need a hand with anything or if you feel uncomfortable. And I'm just gonna go and discard this and document, okay?
Okay, thank you so much.
Okay, I'll see you later. So now that we've finished with the procedure of NZ insertion, I'm going to dispose of and store my equipment properly. Right, so this has been used, so it goes in the clinical waste bin appropriately. pH strip that's used in the receiver, wrapper, and if the Lollipop is disposable, bin it as well. If it's reusable, possibly keep it at the bedside for use of the patient. But for the purposes of this video, disposable. Right? pH strips that are sealed and intact can be stored in a cool, dry place, as well as your tape. If your tray is reusable, clean it with a Clinol wipe for 30 seconds. Right, allow it to dry for 30. Discard your PPE. And do hand hygiene according to WHO standards.